Halifax Citadel Sable Island.
Thank you, Mr. Chair. Hi, Minister. Back. I wanted to ask some questions around endometriosis care in the province. So, certainly I have a couple of constituents who have really had a long struggle, a lot of pain, a lot of ill health, and have constantly brought my awareness up in terms of limited access, wait times, that sort of thing. So I know that endometriosis was mentioned in the budget. I wonder if you can tell me specifically what's happening this year to improve care in the province.
Before I recognize the minister, just another very gentle, very respectful reminder to try and use the minister or the member and not use you when asking questions or responding to questions. I recognize the Honourable Minister of Health and Wellness.
So I thank the member for the question. So there is a $2.4 million investment in the IWK gynecological and urogynecological services. And so that money will be used towards faster access to the clinic. They do have a chronic pelvic pain clinic there, and initially the group was enrolling folks in cohorts of I think every 12 weeks, a certain number of patients every 12 weeks, but they've now moved the model to 2 patients per week, which will allow more access to that clinic. In terms of the gynecology work that's happening, they're looking at increased operational hours, so looking at the addition of after-hours clinics, bolstering of urgent care services, which include implementation of process changes to improve access for urgent gynecological patients, expansion of endometriosis and chronic pelvic pain clinic, so for patients assessed by physicians but have not responded to routine management or pain control strategies, there's more opportunities for them, and also the expansion of the Maritime Centre for Pelvic Floor Health Clinic. So that's how the money will be utilized.
I recognize the Honourable Member for Halifax Citadel Sable Island.
Thank you. And I understand that, in fact, there's only one expert at the IWK in pelvic pain and endometriosis. And so I'm wondering if this funding or elsewhere in the budget there is an intent to increase the number of specialists in the region or to increase FTEs in other roles to support this work.
I recognize the Honourable Minister of Health and Wellness.
So this is maybe not as specific as you'd like, but I will tell you what the utilization will be in terms of folks coming into the team. So in terms of clinical staff, we do see with that $2.4 million investment, an additional physician, just over 2 FTE physicians, a clinical resource nurse educator, 3.5 FTEs for nurse practitioners, and some other staffing to support on the team so that the clinic would be expanded. So it is a significant investment in that clinic to support expansion of services. And I would also say, in terms of the expertise, this will also give opportunity for outlying for a regional obs-gynes as well, I think, to be able to get some advice, and the virtual hallway that we're using as well, I think, will also help for more rural access for this clinic.
I recognize the honourable member for Halifax Citadel, Sable Island.
Thank you very much, and I look forward, I hope that my constituent was watching your answer, and if not, I'll make sure to share those details with her. So, you know, as we work through the surgical backlog and there's a commitment to catch up, prior to the pandemic, of course, people were often given estimates in terms of their surgical wait times, and then that was sort of officially ended. I'm wondering if you could describe, if the minister could describe the practice now. So is there going to be a full return to sort of estimating for folks when their surgeries, whatever they may be, will happen? And how is that communicated to people?
I recognize the Honourable Minister of Health and Wellness.
Thank you. So certainly the announcement that we made yesterday will be a significant step forward for that. So I think currently people call their surgeon that are waiting for surgery, and they have a line of sight based on their utilization, et cetera. But the implementation and the announcement that we had yesterday will track a couple of things. Number one, time from referral to consult, which we really don't have a good line of sight on because not all consults result in surgery. And also then we will be able to look at the surgical wait times for each physician and have a better line of sight, which is why it's so necessary. It's a very antiquated system, and it's not coordinated across the province in a way that it could be with the Z-referral and centralized booking process. So looking forward to the fruits of that investment and really supporting us moving the surgical wait list forward and having a really better line of sight on each physician's wait time and then case-specific, right, or condition-specific line of sight, and it will help us reach benchmark.
I recognize the Honourable Member for Halifax Citadel, Sable Island.
And with regards to the revised process that was announced, how long will it take to have that online, or is it ready to go? All right, so it's ready to go, it's online. And so when will we first be able to look forward in the information and understand, when surgical benchmarks might be met in, surgical wait time benchmarks might be met in certain areas?
I recognize the Honourable Minister of Health and Wellness.
So that work will be ongoing. Some of that we can do now. So as an example, Nova Scotia's tracking to meet the national benchmark of a wait no longer than 112 days for cataract surgeries by fall. Right? And so it depends on, because we have an opportunity to do up to, more surgeries. And then, so each of those wait lists is being, monitored. So we don't have to wait for that. We'll be looking at how we do that and how we increase capacity. So the investments in the surgery, in surgical services. So as an example, designated beds at Dartmouth General Hospital, looking at the hybrid surgical suite as an example. So trying to expand the infrastructure we have as well as some of the contracts that we have for those outpatient surgeries. And as an example, year to date, we've completed 1,098 hip and knee outpatient arthroplasty surgeries, and that same number year to date was 72 in 2019-20. So the teams are really gaining momentum in terms of their ability to complete surgery. So it is encouraging. It will take some time, there's no question, but there are some early, and our surgical growth rate ratio for the third quarter is below 1, which is target, which tells us that we're taking more people off the list than are being added. So there are some really good and encouraging signs that surgical wait list is being addressed.
I recognize the Honourable Member for Halifax Citadel, Sable Island.
certainly sounds like good news, and I can't help but say that, it would be great to have gender affirming care there on the list and be tracking. Is gender affirming care or specific aspects of gender affirming care on the list? And I guess I'm wondering also, when we have services that we just don't provide, surgical services we don't provide in Nova Scotia, we're not necessarily trying to provide them, so that we're always relying on sending people out of province. Do we also watch the national surgical wait time benchmarks for those situations?
I recognize the Honourable Minister of Health and Wellness.
So I thank the member for the question. So I will check. I don't know all of the surgical benchmarks. I don't know what all of them are. So I'll have to check and see if that's there. But I will say, I mentioned earlier, the time to consult, right? That's one thing. So I just want to talk about, that there has been work done in terms of the referral process to reduce that first waiting period of time to consult. And so I'll get the information about from consult to surgery, but certainly trying to shorten that length of time as well with the work that's happening in the department around the assessment process. So we're hoping that will also, obviously, from start time to completion, then that will make a big difference in the wait times overall.
I recognize the Honourable Member for Halifax Citadel Sable Island.
And so, not always connected to surgical wait times, but obviously we only have specialist vacancies that can affect what can be done and how fast it can be done in the province. So it's my understanding that, that we only list the current specialist vacancies, not necessarily by type of specialists on the Nova Scotia Health website. And so I guess I'm just wondering, are there, and I think that's done for privacy reasons. So I'm wondering, still safeguarding privacy, if the minister is able to talk about specific areas, specialists that have been particularly difficult to recruit to Nova Scotia, and areas where it's been easier.
I recognize the Honourable Minister of Health and Wellness.
So, I don't have the exact numbers in front of me, but I would tell the member opposite that psychiatry is one of the more difficult specialties to recruit. Anesthesiology is another one that we, there's a limited supply of physicians, and we're actually looking at piloting in Yarmouth family medicine anesthesiology to support, and emergency room physicians as well. So those would be three that stand out. I know there's others that pertain, and the more subspecialists you get, of course, the fewer the vacancies as a result of that subspecialty, right? But those would be the three that I would say off the top of my head are the most difficult.
I recognize the Honourable Member for Halifax Citadel Sable Island.
And I guess based on that, I have two follow-up questions that might be more than 4.5 minutes, but I'll ask them anyways. I guess I'm wondering if you can reflect, or if the minister can reflect on kind of what makes the recruitment difficult in those three areas, and if there's anything specifically about our context in Nova Scotia that makes the recruitment difficult. And also, as the minister and the government are looking to create the CBU medical school, I previously asked questions about the fact that all the discussion's been about 30 family docs every year once the med school is rolling, but that not everybody who goes to medical school wants to be a family doctor. And so would there be consideration to allowing folks to specialize in fact, similar support? So if I understand there's going to be some kind of return for service for family doctors, could that be extended to folks who start their training at CBU, do their residency elsewhere for their specialty, and then return to the province?
I recognize the Honorable Minister of Health and Wellness.
I forgot your question twice, but I remembered it 3 times, so it's good. So in terms of those 3 specialties, they are hard to find everywhere, and I had the opportunity to meet a physician the other day who was an anesthetist from out of province. I said, "Oh, you're like a unicorn. Like there's not many folks around," and he laughed and he agreed. And certainly the challenges that we experience here, he's experiencing at West in rural parts of the West. So it is a bit of a global shortage. We are looking again. We have to look at the equivalencies, and hopefully that work that's happened around the U.S. trained physicians will open pathways for us to bring folks home who've trained in other places. The first 4 years of medicine are essentially the same, so that's where we're starting. And I think, as we, get to the place, I think those residency seats and potential return to service are always going to be open, but our priority right now is family medicine because, one, we know that we have so many gaps, and there's gaps across the country in terms of primary care and the number of retirements that we anticipate. So we'll start with family medicine, and, again, as they work through that, the expertise at Dalhousie and certainly under the leadership of David Dingwall and Kevin Orrell, as well as working with us, there'll be more to say about how that second campus evolves.
I recognize the Honourable Member for Halifax Citadel Sable Island.
And in terms of specialist recruitment, so perhaps in the 3 areas that that we've been discussing that are the hardest to recruit, is compensation a challenge for Nova Scotia to match compensation offered in other jurisdictions?
I recognize the Honourable Minister of Health and Wellness.
So certainly we're in negotiations now, but my understanding is that we are competitive in terms of those positions.
I recognize the Honourable Member for Halifax Citadel Sable Island.
We can go back to see if there's some questions, and I love that.
Actually, Mr. Chair, I think I will conclude my question.
I don't think you can do that.
I can't do it. Okay, I'm going to stand here for like a minute and come up with 31 seconds and come up with another question.
Yeah, you can just keep talking.
Well, I mean, I think if we're being, if we're competitive and if we're moving forward in surgeries, I don't see why we're dragging our feet in terms of gender affirming care. So, I'm not sure that, we need to increase our capacity here, but we need to increase the access to gender affirming care in Nova Scotia.